The bones of the face are made up of the frontal bone, taking up the largest area of the forehead, the nasal bones, making the bridge of the nose, the zygomatic, cheekbones, and the maxilla. On a skull, you'd be able to see down the nasal cavity to the ethmoid bone, which would form the nasal septum, the temporal bones, and the greater wing of the sphenoid bone, which would make up the back of the eye sockets. The trigeminal nerve is an extremely important sensory nerve of the face. Its three branches travel through the superior orbital fissure, foramen ovale, and foramen rotundum. Before this, having converged in the semilunar or Gasserian ganglion, the semilunar or trigeminal ganglion occupies an area of the temporal bone near the apex called Meckel's cave, which is a cavity in the dura mater. Here it is with the nerve splitting into a ophthalmic branch through the superior orbital fissure, maxillary branch just going along the edge of the zygomatic arch through the foramen rotundum, and the mandibular branch going through the foramen ovale. The trigeminal nerve is sensory to the face, with the ophthalmic branch covering most of the forehead and the upper eyelids, as well as the roof of the nose. The maxillary branch covers the borders of this area, cutting across the cheeks, entering the side of the mouth, covering the upper lip, with the third branch, the maxillary, covering the rest of the face, so including the far sides and the chin, below the chin, the lower lip, and the lower cheeks. So that's the trigeminal branches. The nerves are also sensory to the structures deep to them. So, for example, the maxillary accounts for the upper teeth and gums, the hard and soft palate inside the mouth, the maxillary sinus, which is here and here, and both the posterior and inferior nasal cavity. V3 is slightly different because it has a motor function as well, which I'll go on to later. And the maxillary can be blocked if needing to do dental procedures, since it supplies the superior dental plexus. Trigeminal neuralgia is a disease characterized by episodes of intense pain in the face originating from the trigeminal nerve, and most commonly involves V2 or V3, which are the lower branches to the maxilla and mandible. A surgical treatment for this is called microvascular decompression, and this involves removing an area of the skull to expose the dura about 2 finger breadths behind the ear. The dura and arachnoid membrane are then partly removed to allow dissection of the parts of the trigeminal nerve that cover that area. The cause of the condition is a blood vessel coming into contact with the trigeminal nerve, and during this procedure that can be removed. For their sensory function to access the skin of the face, the branches of the trigeminal nerve have to travel through a series of foramina. The ophthalmic branch has to go through the supraorbital fossa, which is here, and the supratrochlear, which is slightly medial to it. The infraorbital goes through fossa is where V2 travels through to access the cheeks. the infraorbital foramina here, and the third branch, the mandibular branch, through the mental foramina here and here. You imagine the external carotid artery going up here. The facial artery leaves it just about here. It travels along the course of the mandible. The lingual artery leaves the carotid just before the facial. And the facial takes a tortuous course up through the mouth and the side of the cheek to end at what's called the medial commissure of the eye, as the angular artery. The transverse facial artery comes off the superficial temporal, just below the orbital artery, goes over the upper part of the cheek. The anterior facial vein, or facial vein, commences at the side of the root of the nose, just as a continuation of the angular vein, if you remember, the same place as the angular artery. It travels down the cheek, roughly the same course as the facial artery, and then it joins the retromandibular vein to become the common facial vein. Or alternatively, draining directly into the internal jugular vein. The facial vein is important clinically because bacteria can enter it and directly infect the ophthalmic vein, which leads to the cavernous sinus within the cranial cavity itself and can cause infections of the brain or adjacent structures. The frontalis and occipitalis muscles control raising or lowering the eyebrows. The orbicularis oculi, which goes round the eye, blinks and closes the eye. That's the orbicularis oculi. And the orbicularis oris runs around the mouth, acting as a sphincter of the mouth to close and protrude the lips. The buccinator muscle, which you can't quite see here but goes like this along the side of the mouth, is able to flatten the skin against the cheek. The zygomaticus raises the corners of the mouth, and the platysma, which goes from the corner of the mandible to the fascia of the chest, is responsible for drawing the mouth downwards. This one, of course, is the sternocleidomastoid, which goes underneath the platysma from the mastoid process here.